Did you know that 1.1 million people are living with HIV/AIDS? Anyone who is sexually active is at risk of encountering an HIV/AIDS carrier. An estimated percentage of AIDS diagnosed within 3 months of initial HIV diagnosis during 2014 in the United States was 76.4% for HIV and 23.6% for AIDS. Jackson, Mississippi has the 4th highest rate of HIV infection in the nation, according to MS News Now. It is unlikely to look at someone and think that they don't carry HIV/AIDS. Today, I'm going to share with you the information I have researched about HIV/AIDS. I'm going to define HIV/AIDS and explain the history. I'm going to tell you how it's transmitted and the symptoms. I'm going to explain what happens when HIV turns into AIDS and what the treatments are. To have a better understanding of HIV/AIDS and its prevention, you must have the knowledge. HIV stands for human immunodeficiency virus, which is the virus that causes the HIV infection. AIDS stands for acquired immunodeficiency syndrome. Acquired means you can get infected with it. Immunodeficiency means a weakness in the body's system that fights diseases. Syndrome means a group of health problems that make up a disease. AIDS is the most advanced stage of the HIV infection. The definition is clear. However, there are many ways to contract HIV/AIDS. HIV is a sexually transmitted infection, which is an STI. It can also be spread by contact with infected blood. HIV interferes with your body's ability to fight the organism that causes the disease. HIV is a virus that damages the immune system, which helps the body fight off all infections. According to the Centers for Disease Control, which is the CDC, in 1980 was the first start of the HIV/AIDS epidemic in the United States. In 1984, resources finally identified the cause of AIDS, which is HIV. In 1982, more causes among gay men caused researchers to believe that the virus was a gay-related immune deficiency. During this time, it was believed that the people at risk for AIDS were hemophiliacs, which are people who get it by having a blood transfusion with contaminated blood, homosexual men, and heroin users, which is drugs. In 2015, 36.7 million people were believed to be living with HIV around the world. Present day now, we should know that HIV/AIDS is not spread through the air. It's not spread by shaking hands with somebody. It's not spread by hugging on someone or through just casual contact, bumping somebody or in the cafeteria with them, because a lot of people lack the knowledge of HIV/AIDS. HIV is a virus that damages the immune system. The immune system helps the body fight off infections. Untreated HIV infects and kills your CD4 cells, which are a type of immune cell, which is called T cells. And when they drop too low, your immune system, you might as well say it almost dies. And when your immune system dies, what happens? You die. Without treatment, HIV can gradually destroy the immune system and advance to AIDS. If AIDS does develop, it means that the immune system is severely compromised. It weakens to the point where it can no longer fight off most diseases and infection. And a lot of the diseases that you can get when you go with untreated HIV could be pneumonia, it could be cancer, It could be meningitis. That's an infection of the brain. Or it could be, like I said, a sarcoma cancer or lymphoma. You cannot rely on symptoms to tell you if you're HIV positive. Thanks to better antiviral treatments, which are some drugs that they have out now, most people with HIV in the United States today don't develop AIDS. Untreated HIV typically turns into AIDS in about 10 years, but nowadays sometimes it's quicker. The signs and symptoms of some of these infections may include night sweats, recurring fever, chronic diarrhea, you have white spots in your mouth, lesions on your tongue, really tired, fatigued, weight loss, skin rashes or bumps all over your skin. HIV counseling and testing, which is CNT, is an important part of a continuum of HIV prevention and treatment services. Knowing one's HIV status is the key to preventing the spread of HIV and accessing counseling and medical care. If you have sexual contact, either casual or forced, with someone who is known to be HIV positive or is at high risk of being HIV positive, you should seek medical attention immediately. Today, I told you a brief portion of the history of HIV/AIDS, what caused